Let's have a conversation, and our guests are in the studio. Esther Ngatho is a Child Health and Development Program Lead, and George Otieno is Somesha Program Lead at an organization called the Action Foundation. Esther and George, good morning.
Good morning.
Good morning.
Welcome to Kenya's biggest conversation. The Action Foundation, that's where you work. What is the Action Foundation?
Okay, the Action Foundation is a community-based organization. It's registered in Kenya. We work in the low resource areas in Nairobi. We reach children with disabilities just to be able to provide the services that are otherwise unreachable to them or too expensive for them. Yeah, and we hope to empower them, just to help change their lives for better. Yeah.
In how many communities are you?
We are in the 4 low resource areas in Nairobi. That's Kawangware, Mukuru kwa Jenga, Kibera, and Mathare.
Which one is Mukuru kwa Njenga?
That one I think in pipeline.
Yeah, there's several Mukurus. Kwa Ruben, kwa Njenga. Which other Mukuru? So the Mukuru kwa Njenga is the one behind pipeline?
Yes.
Okay. And you said so Kawangware, Mukuru kwa Njenga, where else?
Mathare. And Kibera.
All right. So you, as the Child Health and Development Programs Lead, what do you do?
Our department is quite big. We do quite a number of things. To begin with, we offer early intervention services for children with disabilities. So here we do disability assessment and early intervention through occupational therapy. We also do nutrition as part of our rehabilitative services. We also offer assistive devices, locally made and affordable, low cost, just to help support this child with disability to do their everyday activities. We also do psychosocial support for the caregivers of these children, just to be able to support them to better care for their children. For the caregivers also, we do capacity building, where we build their capacity to take care of a child with disabilities, the know-how of doing that. For the caregivers also, we do caregiver economic empowerment. We understand it's expensive to care for a child with disability, their hospital bills, their medications. So we offer street business school, where we teach them how to do business. And also, depending on the funding, we offer seed money for them to be able to start their kibanda or to be able to start their shop to sell whatever they're interested in. Yeah, so that's what we do.
When it comes to disabilities, there is physical disability, sensory disability, neurodiverse disabilities. And of course, when you're talking about children at the early stages, physical disability you could immediately identify. But now these other disabilities, especially the neuro ones and developmental disabilities, how do you identify those? How do you help the communities deal with that? George?
So thank you very much. I think under that, the reason as to why we take it as an early age, because in disability, we believe that if you go for early identification, you will get the early prognosis. So during that process, we partner even with the government in terms of a Minister of Health to help in doing an assessment, because we have that medical assessment where we get the diagnosis of the condition. So when we come in through as an Action Foundation, we now try to bring in intervention at this particular point. So we also offer the educational assessment, in which we give them proper placement to guide on how intervention will take place. For example, if we get a child who has been diagnosed with even cerebral palsy, it is upon us as the Action Foundation to try and bridge that gap, because we found out that most children with disability have been left behind when it comes to access of education. So we work together with the government schools and the AFBET schools, that is the schools within the informal settlements, through capacity building of the teachers how are they able to handle this kind of children in schools? What are the intervention measures? How are they supposed to conduct their activities in schools in collaboration also with the teachers? So we do a lot of capacity building and material making. Yes.
You know, the work that you do, just from what you've said, doesn't sound to me like a walk in the park. It doesn't sound like it's simple or it's easy.
Sure.
Because you are dealing with a community of citizens who, by and large, are neglected, or at least the help that they need is often not considered, or they don't actually get it. Now, let me go to the basics. In the areas that you work in, do you start by determining how many people actually, one, live with disabilities? How many of them are cases that perhaps need immediate or quick action? Do you have a schedule? Do you have a plan by which you hope to reach the numbers that you've identified as being people living with disabilities? And if so, do you have the capacity to meet these needs? And if not, do you have partners with whom you work closely within the community, beyond the government, so that you can actually help alleviate the problems that these people living, or these citizens living with disability have? I know I've asked you some like around 20 questions. Just pick any two.
I'm going to pick any two. Of course, it's not easy work. It takes a lot of passion to do the work we do. With regards to the disability numbers, currently it's estimated that we have around 900,000 children with disabilities in Kenya. So with regards to being able to identify their needs is where people like George come in, where they do the disability assessments and they're able to determine the need of this child. So based on the need of this child, the intervention measures are provided. Does this child need therapy? Does this child need proper nutrition? Does this child need a special kind of routine or a special kind of treatment? You know, some challenges are surgical, you know, they are correctable by surgery. Some are long-term, like for therapy, it's long-term. So after the assessment is where we are able to determine the needs of this child and then appropriate interventions.
So George, what are some of the needs that we're looking at children with disabilities in Kenya? What would you say are some of the most prevalent needs that these children are facing?
First of all, I think when it comes to matters of education, they have really been left behind a lot. Because if you look at as a country, even me personally, when I was growing up, the only kind of disability I knew of were the four: the visually impaired, hearing impaired, physical, and the intellectual disability. So when it comes to other hidden types of disability like the autism, we're talking about the neurological diverse needs, most of them, people don't still understand them. Even today, you meet a caregiver, they will tell you that if I carry my child to this kind of an office, I will be told, wewe mtoto wako ako sawa. It means that these people still don't understand this kind of thing.
Yeah.
So I think the attitude of the community is still wanting. That's the reason as to why we as the Action Foundation, we come in with the 4 interventions. Number 1, we're talking about the nurturing care, which my colleague has talked about. Then we have the education section of it, the Somesha. And then we have other 2 components, because if you look at disability, you need to tackle it in an holistic approach. Like for example, there is this child, and disability, you know, comes with stigmatization. So the caregiver, that parent, the financial aspect of it. So as the Action Foundation, as we are dealing with the child, the parent is not left behind. They're incorporated in empowerment, such that by the end of the day, you find that the intervention touches the household of this particular child. Yes.
Do all children with disabilities, obviously their needs are different, you know, we can't lump them all in the same and say,
Yes.
you know. So are some able to be in educational institutions, schools like others? and what would they need, even if they were in the same general population with everybody else who doesn't have those needs?
So when it comes to education, I think each and every child has the right to go to school. So it is us who defines, who brings those kind of barriers that this one is not able. Because I'm trying to look into, for example, you go to an institution for even children with intellectual disability, you find a child has the ability even to make the mat, and another one is not able to do the academic work, the cognitive aspect of it.
Yeah.
So it is upon us to look into the ability of that child, not in terms of education, but in terms of what this child can do. That's the reason as to why, as the Action Foundation, we've also went a step further and identified there's a tool that we are working on called the home-based learning, where we are going to help parents, even back at home, for those who are not able to go to school, they will be able to do home-based learning using this toolkit. So that by the end of the day, we want to see that each and every child is able to acquire a little bit of basic learning despite their condition and the area in which they are.
You're assuming that this home-based learning, that all the parents who have children with disability are literate, aren't you?
No, we can't take that for granted. That's the reason as to why we are going to partner with the CHV. So there will be capacity building.
Who are CHV?
These are the community health volunteers who work in the communities. They are going to be our gate pass to the communities. So we are going to work together with the parent so that we ensure that this document or skill is cascaded down to the child.
Have you piloted this scheme? Have you tried it out somewhere to see how it works?
That is what we are doing currently.
It's piloted now.
It is being piloted now.
So how many places are you piloting it in?
We are still working within Nairobi, because my colleague has talked about the 4 areas that we are working with. That is Mukuru, Kibera, Kawangware, and Madari. Like, for example, yesterday we had a training with the caregivers from the 3 sections.
Okay.
So after piloting within Nairobi, we are going to roll it out to other 17 counties.
What did you train the caregivers in?
How to handle the module itself, because the module is categorized into 4 areas. We have something we call the activities of daily living and religious activities. We have the sensory, motor, and social activities. We have the orientation and mobility. Then we have the pre-numeracy skills. So these are just subheadings containing the content that should be given to the child in preparation, because we know that not all of them will go to school. So those children, depending on the severity of the disability, who are not able to get to the school environment, will be helped with this kind of document. Because, for example, if I talk about the activities of daily living, these are just adaptive skills that makes people hygienically okay. So, for example, a child who is having intellectual disability, most of them do not know how to keep themselves clean. So if this document is there, it will help a caregiver on how to instruct a child to do those kind of things. For example, if we talk about the toileting, we know this is a very important aspect of a child, and it's also very difficult for the parents to train children on this, and specifically for now a child with disability. Yes.
This particular model that you're using, where was it developed, and has it been tweaked to suit the needs of the population here, or is the process of piloting going to give you a clear idea of how the people within these areas you live in will respond to it?
Yeah, the document was developed here in Kenya in partnership with the Minister of Education and the KICD, Kenya Institute of Curriculum Development. So we are just waiting for their approval so that we can roll it out. And in the meantime, we are doing the piloting so that in the due course, we will be able to get in some insights that will make us make the document even better, suit the children back at home.
Okay.
Yes.
You know, when you talk about informal settlements in Nairobi, like you've mentioned, these 4 areas: Kahangware, Mukuru, Kwenjenga, Mathare, and Kibera. Many of them do not have access to public education, right?
Yes.
We have about 6,000 informal schools in Nairobi alone. Over 500,000 children in these schools, right? So already when it comes to education, these communities are disadvantaged because they don't have access to public education, which means they don't have access to TSC teachers. They don't have access to qualified assistants, So even the testing, just to know that this child is actually facing a learning disability and all, is a skill that the local teachers in these local schools do not have. So how do you come in to identify and help to identify that this child who is going to this school, aside from the visible disabilities, the other learning disabilities, how do you identify them so that the child who is going to that local informal kindergarten is picked out immediately and then they are given the right assistance?
So, for example, we partner with the Ministry of Education to help us do this. Then we, apart from the public,
how do you do it with ministry?
So first of all, we are in partnership with the Ministry of Education. So whenever we want to kind of do an outreach activity, we go through them because we know that through the Ministry of Education, we have qualified EACS officers.
Who?
EAC officers, that is
What is
Educational Assessment and Resource Center officers.
Yeah.
Educational Assessment Resource Center.
Officers.
Okay.
Yes.
Yeah.
So they're the people who...
Officer at the end.
Yes. Or with the new terminologies, they are called the Curriculum Support Officers Special Needs. Yes. So we work with them. Like, for example, in Nairobi, we have one based at Jogo Road. So, for example, when we want to conduct an educational assessment, even within Kibra, we will have that officer. We work with them. Then we identify the specific schools. Because as Action Foundation, we have other partner schools that we are working with within these informal settlements. So if we are conducting those kind of outreach activities, we go with the personnel from the Ministry of Education so that we conduct this kind of an activity. Then we refer them to respective schools because not all schools will cater for the needs of these children. So we identify those kind of schools. Apart from that, we capacity build the teachers so that when these kind of cases are brought, they are able to handle them in the right manner.
So this child, let's say you have worked with the EAC official at Jogo Road.
Yep.
So the curriculum what?
The curriculum support officers.
Curriculum support officer.
Yes.
So the curriculum support officer comes with you to say Mukuru Kwenjenga.
Yeah.
And you've gone to a certain school. And they do their assessment as per their training and they identify that this child needs some extra support.
Yes.
Now take us from there. What then happens?
So after that, let's say for example that the process has taken place, the child is placed. So what will happen is that the teachers who are there, that specific class, there's a recommendation that is given to that teacher on the steps on how to handle that child. For example, there are something like there is one document that this teacher should have. It is called the Individualized Education Plan. This Individualized Education Plan outlines the present level of performance of this child, the strengths and the challenges that this child faces, and then the intervention measures that should be undertaken. So, for example, child A has a problem with reading.
Yes.
So, within the IEP, it will be outlined how the steps that the teacher should take within a formalized period to work with this child to enable this child acquire this skill that he is lagging behind at.
But this is the same teacher who's teaching the other children in the same class.
Yes.
And I'm assuming that this classroom is congested.
Yep.
This is an informal school in the informal settlement where, children from the local area have just been taken to this school. This is a teacher who's already burdened with the number of pupils that they have.
Yes.
They are operating in a very small and cramped up space. It's not a formal classroom, right? and then you're adding now the burden of this child who is not able to learn, and you're giving them these other extra activities. How do you support that?
So that is where we are having a challenge as an organization and even as the government. Because remember, the work that we are doing is the work of the government. It's not ours. So we are just coming to bridge in the gap. That's the reason as to why through doing this, we are trying to illuminate some of the challenges that happens within these kind of informal settlements. So by doing this, because remember, the policies that we have in Kenya, as far as inclusive education is concerned, they are talking about we need to have an inclusive classroom. So what we are trying to do when we work with the informal settlement schools, we are trying to train teachers on how to create that inclusive classroom environment for all learners.
Our guests this morning are from the Action Foundation that works in informal settlements to support the communities there. Particularly today, we are talking about caring early learning opportunities for children with disabilities. George Otieno is a Somesha program lead at the Action Foundation, and Esther Ngatho is a child health and development program lead in the same organization. Many of the areas that you're working in are not supported by the Ministry of Education in terms of there are no schools, there are no teachers, there are no teaching assistants. And now you go in here and you have a partnership with the ministry. You identify that this child has a disability and they therefore need some special attention and support in their learning. Now, are you able to transfer this child from their community and maybe get them admitted to, say, a special education school that is supported by the Ministry of Education? Or are you only able now to deal with the situation as it is?
In our work, the direction we are taking is we have our services in the already existing schools. I think George talked about inclusion, where every child has a right to education in the normal setting. So in my department, how we support education, we have the therapy centers at the school. So the child comes for therapy and then continues to class. So we bridge that gap of the child has to go to therapy at place X, and then time has passed, it's too late to go back to class. So that's how we support the children.
Okay. Talk about working with government in this. And we see a challenge, obviously, because it's not possible, or rather it hasn't been possible, to really get the help that is required for children with disabilities. Call it what you like, but that's just it, right? How then have you been able to work with government so far? And what would it be that you would say, this is now, we have it, we are getting it right, we're doing what we need to do to make sure that these children are not left out, whether it's in the school system, whether it's in the support that they need if they cannot attend school? What would it look like working with government to make sure that these things then come into place?
So I think I must say to some extent we've gotten support from the government. For a very good example is that, like last week, from Monday to Friday, we had a training workshop at Machakos County, where we, through the Ministry of Health, we got the government official from the Afya House who spearheaded the training of the health providers at the Machakos County where they were inducted on the new tools that have been produced to help in the assessment of children with disability. So I must say at that point they have really supported us. Then when it comes also into the education aspect of it, we are now seeing through that partnership with the government, the teachers are now coming out, and they are also changing to be positive. Because to some extent we were finding it rough that, for example, you find a teacher in a certain school is really willing to offer the service to these children, even to help these children, but the administration is hesitant to do this. So I think when we bring in the Minister of Education, we are now able to bring in the head teachers or the head of the institutions who are also even buying into this. Because for example, if you go into an institution, for it to make it an inclusive, there are a lot of adaptation that requires to be made. So we cannot make this one if the institution itself is not privy to what we want to do.
Give us an example of how this has happened. When, for example, you say that there are children with disabilities in school that have assistive mechanisms like a wheelchair, for example.
Yes.
Give us an example whereby there's been partnership with, in a public school, for example, you're not just going to go in there as the Action Foundation and do your thing, right?
Yes.
There's got to be the requisite permissions granted and all of this. So give us an example where this has happened and it is now working today.
For example, I can give an example with Mukuru. Through the programs where my colleague is working, we have something we call the APT. The APT, this refers to Applied Paper Technology. This is a process in which we make the adapted seats for children with cerebral palsy, for example, with the local available materials like the boxes and the papers. When we make this kind of seats, we have offered some of them even at Mukuru, Kwanjenga. So these kind of seats will now have enabled some of the children who even have had difficulties to position themselves in the normal desks during the classes. So when we offer this kind of seats, they find themselves comfortable and able to continue with the learning process. The second thing in terms of education, there is something called the digital literacy learning. We have incorporated this also to help the teachers. We provided them with the technology, the televisions and the rest that help these teachers in teaching the learners. Like for example, in the literacy, how do you develop the digital storytelling, for example? So by doing so, we have seen that most teachers have come out and they have applied the system that we have given into them. Yes.
I think maybe just to add on to that, we also work with the Ministry of Health in the Child Health and Development Department, where we assist, we just help to implement the rehabilitative strategy. So that is also part of how the government is coming in. They have qualified occupational therapists, they have qualified physiotherapists who also support our work.
How do they do that? Is it structured periodically, or is it on need basis, or when you apply?
Okay, in our partnership, it's an ongoing process. It's a consultative process. Yeah.
Okay. Is it possible, if we look at sustainability of your program, right, as the Action Foundation, you have come into the community, you have started this, and you've established something that is working. How sustainable would it be? Would it be possible is the government already coming in to say, all right, so you have the structures, you have this in place, we'll be sending our officers to you every third Thursday of the month or something like that, so that you know that at least now the government is, previously maybe the government was not present here, but now the government is present, Ministry of Health, Ministry of Education, and such other officers. Because what happens if today the Action Foundation does not get the donor support that it has been relying on, and it moves out of the community?
What we are doing, which is a learning lesson from COVID, where we could not be able to physically reach these people, we have started an integrated home program just to ensure sustainability. So we have involved the community health workers. We deploy our occupational therapists to the homes of these caregivers, where they are taught on a home program. How are you able to support the developmental milestones of your child at home? Part of also the sustainability program is the home learning. Immediately, I believe that when a caregiver is empowered to cater for the occupational therapy, to cater for the home learning, I think that is sustainable enough. Even if the funding is cut, there's someone out there with the information, with the technical know-how to support children with disabilities. And also we know the community health workers, they are located homes by the government, where they go to do the monitoring, they go to check the health situation. So already the government has the structures in place. We just come in to just supplement with the little knowledge.
When you say you worked together with the Ministry of Health, now children are born with disabilities. Now, are there disabilities that could have been avoided? Meaning, are there processes and procedures that mothers could have followed to limit the possibility of them having children with disabilities? And if this is so, does the Ministry of Health assist you not just with the plan of knowledge, but how it is one can avert this and point you in the direction where help to guarantee or to ensure that these avoidable circumstances are completely averted?
Yes, disability can occur in 3 times during the pregnancy of the mother. It can occur during birth and after birth. So, for example, during pregnancy, it could be genetic, for example, Down syndrome or autism. It could also be caused by environmental factors. Yeah. So during birth, it could be caused by maybe the child delaying to receive oxygen, and then it causes brain damage. After birth, it could be because of an injury. Maybe the child fell and they hurt themselves. So in all these areas, I think in the maternal care clinics, we see that there is need to educate the caregivers to follow through with their prenatal clinics, regular checkups. During birth, we see that even the government keeps encouraging the caregivers, please deliver your child under qualified personnel in proper conditions. After birth of the child, you're encouraged to attend the child wellness clinics. I think those are some of the strategies the government is putting in, and even us as the Action Foundation, we keep encouraging the caregivers, please follow through. The information is out there, please follow through. You reduce the chances of getting a child with preventable disability.
Do they also advise on the sort of diets that mothers who are expectant should have? Because deficiencies that are caused by diets can also impact strongly on an unborn child. And some of these things are things that can be avoided. And if one doesn't have the food, what are the sort of supplements that perhaps a mother would need to take in order to ensure that her child is born in the best health possible?
Okay. Nutrition is very key for the mother who's carrying the child, and even for the child themselves. So in the maternal clinics, they are weighed. How are you gaining the weight? The diet is assessed. How are you feeding? There are some areas. In terms of supplements, we have the supplements that are issued by the government, the folic acid and iron supplements, which help to prevent a child with congenital issues. So the strategies are there.
How do you measure your success as the Action Foundation?
At the Action Foundation, we do not measure very big success. It's in small milestones. Disability is lifelong. There is no cure. So our success is a child comes in, they are not able to achieve their basic milestones of sitting, of standing, of holding. But after a few months with consistent therapy, the child ups and stands. The child is able to hold the cup and drop. That's a success. Or we see a child who has like bow legs. The caregiver doesn't know where to start. So we do maybe a referral for surgery. We do support for the surgery. So we'll do like the pre-surgery management, post-surgery management. This child is able to walk and they're able to go to school, which is the goal of our department, to be able to support this child to transition to school. So when a child is able to achieve their milestone, transition to school, that's success. Yes.
Would it be the preferred situation that children who eventually become adults with disabilities then can be a normal working part of the rest of society if those who then are tasked with the responsibility of making that environment conducive actually do what is supposed to be done. The different interventions that we talk about that are needed happening at the same time with support from government, happening at the same time with an understanding of what needs to be done. Can we then have a place where, or can we then have a society where children with disabilities, adults with disabilities, don't have a more compounded situation because these other parts are not doing what should be done? Can we have that kind of situation?
I think it's possible. Like my colleague George mentioned, disability is more of the response of the society to someone's impairment. So if as a society we are able to respond to their needs like we respond to any other person's needs, I think that would be an ideal. If we are able to end the discrimination, the marginalization, if persons with disabilities are included, so I think that would be an ideal situation. Yeah.
I've heard you mention your collaboration and partnership with the national government, Ministry of Education, the Ministry of Health. Are you working with the county government, the Department for Early Childhood Education, the Department for Health?
Yes, I must say that we are working with the county government too. Like for example, when we are going to target the early childhood education centers, we will have to go through the county government because the ECDs are devolved in the county.
Yes.
So we have to work with the county government. Like for example, we go conduct trainings for the teachers. We go conduct the educational assessment in these kind of schools. We need to incorporate the county government into the service.
Yeah.
Yes.
We also work with Kajiado County, Machakos County in our rehabilitative outreaches. We've reached Kilifi in addition to Nairobi County. So they are part and parcel of our work.
How do you mobilize your resources? Who supports your work?
Okay, we are supported by donors, well-wishers, anybody who wishes to support us. For example, someone will come in and say, I see the need of diapers. They will donate the diapers. We also apply for grants that help support our work. Yeah.
Have you worked with maybe other institutions, say private schools that are supporting children with disability, to see maybe there can be some sort of sponsorship, scholarship for a child who is in one of your communities who would then be able to move into this other school to get the specialized or kind of education and care that they require?
Yeah, we do that. Like I said, in my program, our goal is to transition this child to school. So we work with the nearby schools in the community just to support those children to accept these children to begin with. Like George mentioned, after the education assessment, a recommendation has been issued to take this child to school X. When you go to school X, they are like, we don't have the capacity.
Yeah.
So what we do is to support the nearby schools, the private and public, to be able to accommodate these children. Because I think once you empower them, once they know the know-how, as in George's program, they are able to be receptive. They are able to accept these children. Yeah.
Do you have some success stories? I'm sure when you're talking about the work that you do, even when you're talking about what you do with your friends, you tell of a specific story that just warms your heart.
Well, I think I want to talk about a young boy who came to us with bow legs. This story touches my heart because the mother had given up. They didn't know what to do. There are so many gaps in the community. They don't know what to do. She was fearful. She's hiding this child because she feels this is not normal.
How old was the child?
The child was 3 years at that time. So she came in. we welcomed her. She saw other children who have even more severe disability, and she got encouraged to even continue with the therapy. With time, the child was able to go for surgery, corrective surgery, for one of the legs. Then we supported them in post-surgery management. After a few months, they went for surgery for the other leg. As we speak now, the boy is 7 years old. He's enrolled in school. He just comes to see the other children and just play together, because the community we have in our therapy centers, it's more just to also create a social place for these children. Most of our children with disabilities are put in a corner in the house. Nobody talks to them. Nobody plays with them, you know. So when they come at the center, there are other children who look like them. Remember, children are intelligent. You know, they're asking themselves, why am I like this? Why is my dad not like this? But when they come and they see a community of children with similar challenges, who are going through similar treatment, they are happy for that. We have also the caregivers who feel alone in the community, you know. The neighbor does not relate because their child does not have disability. So in the community we create, they come and talk through their issues. They come and see, I'm not alone in this, yeah? And that encourages them to even continue seeking help for their children.
How did this mother end up at your center?
Well, she reports that it was just word of mouth, people telling them, there's an institution somewhere that deals with people with disabilities, and therefore she came in. Yeah.
Okay. Do you have a story?
Yeah, I must say, number one, I want to bring it in terms of a teacher and a student. So there's this child or a parent who moved around, because, you know, with the issue of disability, for the parent to sit down and relax, they would have walked for long.
Yes.
So what happens is that this parent had moved almost all over the country looking for services, and it happened that the boy had dyslexia. This is a condition that prohibits one from reading and writing. So he couldn't understand what this was. So when she was referred to me, and I did educational assessment, because I'm also one of the CSOs. So when I did this, I placed the child into a certain institution. Within 3 months, the parent came back and called me. She couldn't believe, because one, the boy his self-esteem had been raised, in that they went in a competition that was held at Kenyatta National Hospital, this kind of the cultural day, and it happened that the boy emerged number one as Mr. and it was international Miss and Mr. Children with Disability. On top of that, currently the boy is now able to make footmat, and is making a living from it. So the mother is like, where were this kind of people to give me this kind of services?
Indeed.
Yes.
Beautiful story.
Yeah.
Thank you very much for joining us today, George Otieno, Somesha Program Lead, and Esther Ngatho, Child Health and Development Programs Lead at the Action Foundation. Asanteni sana for joining us.
This is the Situation Room, the only way to start your day.